Part 1. Decoding IVF. Essential tips for a successful journey. Infertility affects 1 in 8 couples in the United States. For women aged between 30-45, declining egg quality and quantity are major factors. The pressure to act can lead to rushed decisions. By age 40, a woman's chance of conceiving naturally each month is only about 5%. IVF offers a ray of hope, but it's not an instant solution. Success rates vary widely, and the emotional, physical, and financial toll can be immense. But what if you could approach this decision armed with clarity, not fear? Fear comes from ignorance, and ignorance can be dispelled by knowledge. Pima Chodron. Part 2. Is IVF right for you? Weigh the pros and cons. In vitro fertilization, IVF, is a fertility treatment that facilitates conception outside of the body by combining together egg and sperm in a laboratory. For women with blocked tubes, unexplained infertility, or advanced age, it could be a decisive factor in your success. But it's not one size fits all. Understanding your specific diagnosis, egg reserve, and overall health is the key to predicting your chances of success. IVF success rates are about 27% for women aged 30-37, but drop to 5% by age 43. And then there's the question many forget to ask. Should I go for IVF now, or are there alternatives to try first? Decision is a sharp knife that cuts clean and straight. Indecision, a dull one that hacks and tears and leaves ragged edges behind it. Maya Angelou. Part 3. The financial burden of IVF. Is it worth it? The average cost of one IVF cycle in the U.S. is $12,000 to $15,000, often excluding medications and additional services. Many need multiple cycles. Only 19 states mandate some form of fertility treatment coverage. But there are ways to reduce costs. Scholarships, loans, and clinics offering bundled packages. Informed decisions can help you to navigate financial issues. And yet, the cost isn't just financial. The price of anything is the amount of life you exchange for it. Henry David Thoreau. Part 4. IVF. The toll on your body and mind. IVF demands resilience. Hormone injections, egg retrieval, and 2-week waits can take a toll on your body and mind. Anxiety, depression, and relationship strain are common. That's why support systems, friends, partners, or professional counselors are essential. You're not alone. Seeking assistance is a wise choice. But there's another layer to IVF most don't consider. It does not matter how slowly you go, as long as you do not stop. Confucius. Part 5. The dark side of IVF. Uncovering the risks and ethics. IVF, like any medical procedure, has risks. Ovarian hyperstimulation syndrome, multiple pregnancies, or even rare long-term complications. Ovarian hyperstimulation syndrome affects about 1 to 2% of patients, but can be life-threatening. And then there are the ethical dilemmas. What happens to unused embryos? Are you prepared for difficult choices? These are decisions best made with both your heart and your head. The hardest thing in life is to know which bridge to burn. David Foster Wallace. Part 6. From Infertility to Parenthood. Your IVF journey to happiness. Despite the challenges, IVF offers unparalleled hope. For women who once thought motherhood was out of reach, it's the bridge to a dream fulfilled. It's a testament to human resilience and the miracles of science. But it's only a miracle if it's right for you. So how do you decide? The only thing that matters is how well you play the hand you are dealt. Randy Posh. Part 7. IVF. Myths debunked. The truth you need to know. The key to making a well-informed choice is preparation. Research clinics. Understand the processes, and don't hesitate to ask questions. And most importantly, don't delay. Your biological clock won't wait, but taking action today can open doors tomorrow. IVF isn't just a medical decision, it's a deeply personal journey. But with the right knowledge and support, you can face it with confidence. Visit our blog for your free guide, How Not to Remain Infertile, and take the first step toward clarity and hope. Your future is waiting. Link is given in the description below. Subscribe for more expert insights on fertility and wellness.